Okay. All right. Good morning, good afternoon, and good evening, everyone, and welcome to UCSF's Center for Global Nursing's Impact Series. This series aims to provide a platform for our nurses and global partners to share their remarkable work, offer valuable insights, and inspire our global community. Following the presentation, there will be a short Q&A, so feel free to write your questions throughout the presentation in the Q&A box below. My name is Dr. Rebecca Silvers, Director of UCSF Center for Global Nursing, and it is my very big pleasure to introduce this month's speakers, Joyce Jere and Dr. Schell, to present the incredible work of GAIA Global Health. Joyce Jere is the Malawi Country Director for GAIA Global Health and a Malawian registered nurse midwife. She holds a Bachelor of Science in Nursing and a master's degree in public health with a focus on maternal and child health. Joyce just first joined GAIA to coordinate USAID's funded nursing scholarship program to rebuild Malawi's healthcare workforce, and her leadership led her to appointment as country director in 2015. In her current role, she oversees national operations, partnerships, and strategy, helping to strengthen health systems and expand access to care for remote and underserved communities. She has also contributed to important research, global advocacy focused on nursing workforce development and health equity. We are also honored to welcome Dr. Schell. She's an adjunct professor here at the UCSF School of Nursing and served for more than 2 decades as the International Programs Director for GAIA Global Health. She currently serves on the GAIA board and as the co-chair of the Global Committee of the Association of Nurses in AIDS Care. Through her longstanding partnership with colleagues in Malawi, she helped develop and scale GAIA's programs, including training over 600 community health workers, supporting more than 900 nursing students, and expanding mobile clinic services to reach rural communities. Today, GAIA's scholars represent approximately 10% of Malawi's public sector nursing workforce, and I'm excited to hear more about their work through today's presentations. We are truly honored to welcome Joyce Jere and Dr. Schell. Joyce and Ellen, thank you for being here. It's a privilege to have you with us, and I'll hand it over to you.
Thank you so much, Dr. Silvers, and we're so delighted to be here. I'm so delighted to be presenting with Joyce, who I've worked with for many years and remains a good friend and a shared work, and she has so much to say about this. So anyway, I'll begin. If I could have the next slide, please. Just to tell you about GAIA Global Health, which is a Bay Area nonprofit that was founded by an Episcopal priest, Bill Rankin, who is Sally Rankin's husband. Many of you may know her as a longtime professor at UCSF, and the renowned UCSF neurosurgeon, Charles Wilson, to respond to the HIV/AIDS crisis in Africa. So we have roots deep in UCSF and some really nice associations. We've actually worked with many UCSF students from the Global Health who've done their projects with us. So GAIA Malawi is an independent Malawian NGO, and it partners with GAIA Global Health to provide these rural health services and nursing education in Malawi. And it strengthens underserved African communities through community-based healthcare and health workforce development. Next slide, please. So GAIA Malawi is truly a nurse-led organization, and you're looking at the top 3 in the leadership, who are all nurses. Joyce Jere, who will be speaking later today, and Nelson Kozamba, who is a programs manager, and Lucy Nyarinda. Nelson has an MPH as well as being a registered nurse midwife, and Lucy has a Master's of Science in Midwifery. And they're the programs manager and deputy programs manager, as you can see. Next slide, please. So a little bit about Malawi, if you're not too familiar. It's a country of about 22 million. The population is very young, as true elsewhere in sub-Saharan Africa, 46% under age 15. And it's very rural population, 82%. There's a high HIV burden, although Malawi is really to be recognized for its significant progress against the AIDS epidemic and has met the UN AIDS 95-95 goals. But there's still 5.4 million, prevalence of 7%. And malaria is another significant thing. And that actually made great strides against malaria. But still, they have over 5 million cases in 2025. And increasingly, we're seeing non-communicable diseases. So that's become a focus of our work as well. Improving, but high maternal and infant mortality, as you can see from the statistics on this slide. Next slide, please. So now I'm going to hand it over to Joyce to talk about our community-based health services, the mobile health clinics. Joyce, can you come on?
Thank you, Dr. Schell. I'll present on the community-based health services and focusing on the mobile health clinics. And we operate these activities in alignment with the World Health Organization, universal health coverage, and also the health sector programs in the Ministry of Health. So under mobile health clinics, we respond to increased access to healthcare services. And the reason being, 82% of Malawi population lives in the rural areas, and more than half of the rural Malawian live further from the 5 kilometers from the government health facility. And the distance to care affects the health-seeking behavior and also the health outcomes of our community members. So because of this, we launched the mobile outreach clinics in 2008 with one clinic. Mainly the focus was to provide HIV services, but we realized that if we only do that, we'll promote stigma. So to reduce that stigma, we operated integrated services with the primary healthcare services. Next slide, please. So on the daily basis, Monday to Friday, we provide services, different services. There's communicable and non-communicable services. And as you can see, there is a vehicle there on the which has been displayed, and we have community providers who include the clinical officers, nurses, HIV diagnostic staff, and drivers, and also a follow-up care who go to the outreach clinics very far from the nearest health facility to provide the services under the primary health care. And these are preventive services, and also we provide counseling, health education. We also provide maternal and child health care, which includes antenatal and also postnatal care. And we also provide health education, and we also provide the emergency transport in case of very sick patients. So the clinics are provided on Mondays, Tuesday, Wednesday, Thursday, and Fridays only. And every week on Monday, we go to a different village. So the following week, also on Monday, we go to the same village. And on Tuesday, we go to a different village. On Wednesday, to a different village, etc. Next slide, please. So as you can see, these are our services. You can see that we give health education to women. Most of the clients in our clinics are women and children. And we also provide under 5 services like weighing. We provide medicines. And the good thing is that our medicines are provided by the district health offices, so they are under cost share. And this helps us reduce the cost of the mobile outreach clinics. And we have, we use the data information that the district uses, and you can see a healthcare provider entering data in the health systems for the district. And you have also seen a clinician providing the services or checking the patients, and we make sure that the patients have really been have received a real diagnosis and referred when it is necessary to do so. Next slide, please. So through these mobile outreach clinics, since 2020, in 2025, we provided 8 clinics in 3 districts, which meant 36 clinic visits in a week. And we provided 210,438 clinic visits. And out of these, 103,000 clients comprised of 70% female and 40% were below the age of 12. And 24% below the age of 5. So the top 5 conditions included upper respiratory tract infections, musculoskeletal infections, conditions, hypertension, malaria, and gastroenteritis. So we also have seen a new trend whereby we have increased number of women coming for our antenatal and postnatal care within the communities, especially in Mangochi district. And in terms of the cost, each clinic costs 160,000 K per year. And out of this, 40% of the operation cost, especially medicine and staff, are covered by the district health offices. Next slide. So we have seen also in 2025 a lot of HIV cases, like we tested the 3,900 clients and 83 tested positive, which is 2% positive yield. So in order to make sure that the clients receive treatment right away, we started community ART provision within the clinic stops, and we also have specific community distribution points. So we also provided, we have also planned to provide the antiretrovirals to female sex workers within our communities. So this will support the Malawi progress towards the WHO triple elimination targets. And as you can see on the table below, when a client comes, for example, for antenatal care, we provide HIV testing, syphilis testing, and also hepatitis testing. So in 2025, for antenatal care women, we tested 1,320 tested positive, and we also tested the 1,046 on syphilis, and 16 tested positive. And we tested the 1,172 on hepatitis B, and 12 tested positive. So we are on the track to identify more positive clients so that they can be linked to care and live a normal life, a normal quality life. Next slide, please. So still on highlights of 2025, as I said before, we provided 210,000 clinic visits. But one thing that we noted is that through our preventive measures on malaria, there has been a 70% decline in malaria cases, mainly because we have now initiated in some of the districts rolled out the vaccine for malaria cases, especially for under the age of 2. So these are the children who are affected with a lot of malaria cases. So because of the vaccine for malaria, there has been a lot of decline in malaria cases. And we also distributed the bed nets for pregnant women under 5 and also school-going children. Hence the reason for the decline of malaria. And as I said, the 5 top conditions included the upper respiratory tract infections. You can see the trends, they're not different from 2024, 2025, except for the malaria cases, which have dropped quite a lot. Yes, next slide, please. So you can see that the antenatal clinic visits are growing. In 2025, we started with the 1.4K, then we increased up to 5.3K. Next slide.
Yes.
So, Ellen, you can proceed with the nursing scholarship program.
Thank you. Yes. So this is the other main thrust of our work, which is health workforce development and the nursing scholarship program, which was launched in 2005 with private funding, and then became expanded both from Global Action in Nursing of UCSF and USAID funding. So the reason why we did this was Malawi was suffering a really bad nursing shortage, in part because when we were launching it, HIV was still taking a lot of nurses' lives, and also because some nurses were leaving the country to go work in the UK, mostly, and other places. And we wanted to find a way to help support them and get them to stay in Malawi. So the target was economically disadvantaged nursing and midwifery students with wraparound scholarship support for students. So we don't just pay the student fees, because what happened was when Sally Rankin and I went to Malawi and talked with the principal of Kamuzu College of Nursing, she said, I have students I can accept, but they can't afford the student portion of the fees. And especially at that time, many of these students were themselves AIDS orphans, had managed to get accepted to nursing school, but didn't have the money to pay the scholarship. So the wraparound scholarship supports not only their fees, but also provides uniforms. We actually have had some students over the years who owned their first pair of shoes through what was supplied as part of the program, just to give you an idea of the level of challenges they were facing. And they get a stipend. Many are responsible for helping to support younger siblings, and that helps them. The program sponsors the students in all the various programs in Malawi, the diploma level, bachelor's level, and those who are upgrading. And we partner with 6 different colleges in Malawi. It costs about $2,500 a year for each scholar, or $10,000 to get a nurse all the way through the bachelor's program if they're doing a 4-year program. They agree to serve in Malawi for the same number of years that they're sponsored. And we've replicated this model in Liberia during the Ebola crisis. We sponsored some students there, and now we're expanding into Zambia with this program. And that's being led by the staff in Malawi, the GAIA staff in Malawi. Next slide, please. So just give you some of the stats. We've had 760 graduates to date, and we have 146 students now enrolled in the program. Students, when they get the scholarship, they are guaranteed that we will sponsor them all the way through, provided they obviously keep up academically. 96% have completed their academic programs. 99% successfully licensed, and 99% will remain in Malawi, with 81% of them working in the public sector where they're most needed. So the program, in the years it's been running, it really has achieved the goals that we had of wanting to keep nurses in Malawi, and build the nursing workforce. And as has been said, GAIA Scholars now represent about 10% of the public sector registered nurses, and serving across Malawi's 28 districts. 75% female, 40% have lost one or both parents. And then you can see the numbers of the nurses that we've supported in Malawi, Zambia, and in Liberia. And we estimate that each GAIA nurse graduate will provide over 300,000 high quality patient visits over the course of their career. So this is a real effort at sustainability of the health workforce in Malawi. Next slide, please. So now we have also added in 2017 a nursing fellowship program. When we started the nursing scholarship program, we pretty much were sure every nurse would be able to be employed right away within the public sector. And then as funds grew tighter for the Ministry of Health and there were more nurses produced, it became more competitive. So we were not having nurses deployed straight away after they were licensed. What this provides is a paid fellowship. It provides about 75% of their salary, which encourages them to continue their job search and gives them some training in things like resume writing and interviewing skills. They can be sponsored for 1 to 1.5 years. And the target is the recently graduated but not as yet employed nurses. We also provide in-service trainings on priority areas such as ART, antiretroviral therapy, initiation and administration, as well as special areas of maternal and child health that make them more attractive to employers and make them more competitive in the job market. And we've now expanded this into Zambia with private funding from the Health Carousel Foundation. Next slide, please. So this is, for the fellowship, we've supported 368 fellows, 16 currently in Malawi, and in Zambia, 10 across 5 health facilities in the eastern provinces. So we're excited about that new development, adding Zambia to our work. Next slide, please. So I wanted just to say a little bit about the funding disruption that's happened on account of the closing of USAID, the termination, and the funding that was pulled. So we had our nursing scholarship program has been supported over the years by 2 different USAID grants. And the second one, we were basically in the middle of that when we got the notice to stop work, and all of that funding was pulled. And it immediately affected 95 scholars. As I said, when we take on a scholar, we're looking up to 4 years into the future of sponsoring that person. And the grant from USAID was to be able to assure that over the years. It also affected, we pay for the students to get their licensure exams and some clinical mentors, and those were all affected by the termination of the agreement we had with USAID, and also affected fellowships because that was part of the agreement. And you may know something about the Nursing Leadership Initiative, which was in several of the African countries to help develop nurse leaders. And GAIA was responsible for overseeing that program in Malawi. And that, with the funding termination, it was only half, the goals of that were only half finalized. We were able, through a successful stabilization campaign, which our donors in the US and really stepped up to make up for the over $1 million that we lost in that USAID grant. And we were able to meet the project targets that are listed there of 260 full scholarships, 92 partial, and the fellowships. So we actually exceeded that number. And the reason why we exceeded is sometimes students in their course of their fellowship find permanent work quite soon into it, and then that allows us to take on another fellow. We are pleased, and we've been able to take in now with the funding that we've raised privately, new cohorts. But still, we hope that there will be a change in U.S. policy to revive the support that we do abroad that has been really impactful in the world. And there are lots of could say a lot about the trickle-down effects of these funding cuts that are making it more difficult for people to get the antiretrovirals, leading to some increase of people who are dying on kind of being unable to get services. And that's across all the systems and the non-governmental organizations doing work under that they were doing under USAID funding. Next slide, please. So that's it. We have time now for questions and discussion. And thank you very much. Zikomo is the Chichewa word for thank you.
I love it. Thank you both so much for this exciting conversation. I think it gives me so much hope to see the impact of a program that's been established for so many years, that's created and overcome some of the challenges that so many of us are still navigating today. I think there's a lot of lessons learned in sustainability of the workforce, in nursing migration, what keeps nurses, what keeps nurses where they actually want to be, which is usually at home, and what helps uplift the health of the workforce. You can change the health of the country by changing the workforce, and I think it's very inspirational to see also such dedication and leadership and nurse-driven leadership at that, really impacting the country and the society on a really, really big level. Looking at your numbers, even with one year to another with malaria, I think you're making a huge difference. And we're really honored to have you here and to hear what you're doing and the story of GAIA Global Health over the years. But and it is, oh my gosh, so difficult to hear about some of the challenges, but exciting that you have had such a sustained impact, that your community that you work with really believes in this and has seen the impact, that they still want to invest in nursing and invest in the health of the people of Malawi. And I think I just really appreciate hearing that all of this and being able to share this with our community. One question that was in the chat that I'd love to bring up is maybe a little for Joyce and also for Dr. Schell, but where do you see the future of Malawi? It seems like the health needs have changed a little bit over the years, and you guys have migrated in a way to really meet the needs of your community. And do you anticipate, new needs arising or different care models being needed for the clinics and the work that you guys are doing?
Thank you very much, Dr. Silvers. I can take that question and then Dr. Schell will continue. I'll talk mainly on the community outreach programs that we conduct. As you have seen in the presentation, we are focusing more on community maternal and child health and reproductive health, offering the antenatal care, postnatal care, because most women walk very far to get the services and they have to pay a lot of money to get the services. So we are now focusing and we'll still strengthen the focusing of reproductive health, maternal and child health. And we have introduced something interesting. We are now have ultrasound, mobile ultrasound, where we go to the clinics or into their homes and do the ultrasound, and the women are able to be diagnosed with the twins or breech pregnancies, and they are referred for care in good time. So that's one thing that we would like to expand in. And another thing that we have also noted is the mental health activities. There is a lot in the world that is happening, that is bringing stress. There's a lot in Malawi that is happening, and a lot of youth and men are committing suicide, some affected by the mental health issues. So these are some of the issues that we want to expand in future to provide outreach mental health clinics. We've also seen a lot of surge in non-communicable diseases, diabetes and hypertension. And at the moment, when we go out in our clinics, we make sure that we have, we diagnose women or men with the diabetes. So we have glucometers, and we also have tools like the HemAQ machine to make sure that we are able to identify women who have anemia in pregnancy. So these are the areas that we want to focus on, the non-communicable diseases and also much of reproductive and maternal and child health. And Ellen, you may add on what I have said. Thank you.
Well, just also to say, I think, especially with the reductions in funding around HIV, I think we continue a focus on preventative education, especially among youth,
Mm.
to make sure they have the information to protect themselves and make good choices. Yeah.
Yeah, I think it's incredible to hear your ideas and the needs of your community as they shift over time. And I think it's amazing how nurses can adapt and continue to provide with clinical officers and healthcare workers and teams just really comprehensive care. And I love the idea of decentralizing even the diagnosis. Because if people know the care that they need might be a higher level, then they might be able to seek care earlier and avoid more complications. And I think that with women that are receiving antenatal care, along with diagnosing diabetes early, I think we see a lot of preventative harm happening when we're able to sustain an early diagnosis, which I think is something you guys are really working to achieve and seems to be making an impact along with all the other work you're doing, which is I'm just so grateful to learn about all this because it's truly a model where we've seen Malawi is running the programs, public-private partnership, formerly USAID funded. It also is a really interesting model to see how we can really develop health systems as a team and as a global nursing community. I think at the Center for Global Nursing, we really talk a lot about partnership and what that looks like and how we can all learn from one another. And I'm learning from you today. And I know that you guys learned probably so much over the last decades together. Really to just build these solutions that are sustainable, that impact health. And again, just such an honor to be here today with both of you. So I want to thank you again for your time. Thank you to all that joined us, and we will put this up on our online space for those that might want to watch it later. But really, thank you to Dr. Schell and to Joyce for sharing the incredible work of GAIA Global Health. We appreciate having you today.
Thank you for having us.
Thank you.